You don't need to tell me.
Yo, hello. Welcome everyone to the Healthy Heart webinar. Yesterday we had a live studio audience for our diabetes chat. And so I'm going to need you guys to just clap at home whenever something's really good, okay? Because it was really
Okay.
fun to just have some live people there. If you were on the webinar the one time, I downloaded like a live studio audience thing so that it would clap and sound really professional. But I don't have that today. So we're going to rely on you clapping at home. And we're excited because if you were on the webinar yesterday, you know that the Barton team is all together at a retreat. And Joe kept mentioning, I was invited. I just wasn't able to go. We had some family stuff. So I'm not with them, which is really sad. I'm trying not to think about it too much. But I'm excited that they're having a wonderful time and they get to be together with our entire families, which is pretty amazing that we get to do that. So I know my daughter, she's 12, she's living her best life there. I've been told she hasn't worn sunscreen one time, which is not good, but that's okay. So, speaking of family, we do have a special guest here today that you probably don't recognize. And this is, you guys know Joe Barton. He's been on our webinars before. He's the founder of the company. Oh, look at that guy. Well, that's a different view of him. We haven't seen
You
that.
made it.
Joe, you need to get in here. Do you want to introduce this guy? Just lay over the three of them.
There we go. We're in.
There you go. Okay, so Joe, tell us who this guy is.
Special guest.
I mean,
Ladies
younger
and-
brother.
Ladies and gentlemen, my younger older brother,
Right.
Jim Barton.
Well, we're excited to have you. And you know what? This is the fun thing about our webinars. We plan them out, but they're subject to change based on what's happening in the world, in the community, who we run into. And so we're excited to have him here because in some discussions on this trip, I think this is not by chance at all. He got to meet Dr. Saunders and some things came up in their discussion. And so I'd like to just start the webinar. Well, first of all, I'm going to say this. Dr. Saunders is a doctor and he's really good, but he's not your doctor. And so I do need you to talk with your medical provider before you implement any of the things that we talk about today. But tell us kind of what happened in your guys' conversation and tell us why he's on the webinar today.
So one of the things that we've been doing here on our work/fun, more fun than work trip is we've looked at some of our products and have tried to decide how can we improve them? How can we make them better for customers? And this guy just happened to jump in on the one that was talking about our Healthy Heart Support supplement. And he was, as we were going through some of the videos, he was asking great questions as someone who hasn't seen any of our products before. And he's actually had a little bit of a heart scare, if you would say, recently. So he comes with a lot of concern, but also relief. And he comes with questions with Dr. Saunders, for Dr. Saunders, because he has results that he wants to share and ask about, and just learn about whether or not he can actually address heart issues naturally with or without our products. But we've often talked on this webinar, we'd love to have guests. We answer customers' questions all the time about their results. So we just thought this would be a great opportunity to have Jim with us.
Sure. Should I just roll with
Yeah.
Yeah.
So anyways, where I started yesterday in the conversation is just that. About a year ago, well, earlier this year, I had an annual physical and I mentioned to my doctor that I have heart pains from time to time but I exercise a lot. And I says, but a heart's a muscle and it's probably just sore from working out. And she said, that doesn't sound right. So she recommended a stress test, which I was grateful for because I thought, okay, let's rule it out. I did a stress test and they said, and I don't have the results right here, I'd have to find them, but they couldn't get a good read on the post after the running on the treadmill. Then they lay down and they do the
Echo.
yeah. And they said they couldn't get a good echo read, and they said it might have been because of my biceps. Now I'm bragging right now to little brother Joe. But anyways,
I definitely can tell you're related.
so anyways, that's what they said. So then they recommended the you're able to say the terminology, it's a
Coronary-
CT.
Coronary calcium score.
Yeah, so where they shoot the dye in and you go through a CT scanner, right? Yeah. So they did that, and which I was glad for, to see if my arteries were clogged or anything like that. And now they sent the results to my doctor. I have to go back and see her. It hasn't been that long. I'm not avoiding it, but according to what I'm reading, it doesn't sound like I have clogged arteries or anything like that. And you glanced at this real quick. I think that's the same one, isn't it?
Mhm.
And it looks like, based on just a real brief review of this prior to the show, I mean, less than a minute, but that it sounds like it looks like overall.
Overall
That's good.
assessment, it's good. And so the coronary calcium score is 92, and under 100 is a decent score for your age. And you have it in 2 arteries only, and there's small amounts. So you're not at risk for heart attacks or
Yeah.
heart damage.
But when they say calcification, is that what it is?
Yeah. Yeah.
I mean, is that like the like on plumbing pipes, you see debris,
Well, it's kind of like that, actually.
classification? I mean, where but it sounds, is it on the outside?
It's
what
on
they're
it's,
seeing?
it's on the inside. So
Oh,
they're
okay.
looking in the wall
Okay.
of the artery. And in the wall of the artery, they see calcium deposits in there. And so, yes, it's kind of like plumbing building up calcium deposits
Okay.
and getting narrower.
But apparently it isn't real bad to where they have to do a stint, or my brother had to have a stint, our oldest brother, Scott. So I'm glad to hear that. But the thing is, I'm still having heart pains, and it's kind of troubling to me. And whether this is accurate, and we haven't talked about this, is could it be due to stress or grief? Now, Joe doesn't share everything with Joe, but I've started going to therapy because I'm going through some changes, good changes, but my therapist has got me getting in touch with feelings of grief and like relationship, some of his relationship grief, like breaking up with somebody or being away from somebody. And it's amazing how much pain that can cause my heart. And I think that's more, and the more I'm in the therapy, the more I'm feeling it. Whereas before it's like, just don't even think about it and be numb to everything. So I'm having a hard time figuring out. But I mean, this is helpful because you read that information and you were able to interpret it for me, that I'm not at high risk based on that of having a heart attack. But still, the pain is, and I worked through it, you know, as far as I don't like stop and try to get rid of the pain. I mean, I don't know if you can do that, but if I'm feeling, I mean, I'll go exercise or whatever. I'm not like being paranoid and not doing anything. And I think that's okay. I mean,
So when you feel it and you go exercise, does it get worse?
no, it probably gets better.
Gets better.
Yeah, it
Okay.
goes away.
Where, if you could point with one finger, where would the pain be?
I mean, I think it's my whole heart. I mean,
Okay. So right in the middle.
yeah, I mean,
Do you feel it all over, or do you feel it just in one spot?
I feel it all over.
All over.
rather
Okay.
than one spot.
So the question of chest pain, is chest pain heart pain all the time?
Oh.
And most of the time, no, it's not. Most of the time it's going to be chest wall pain, pleurisy, lung pain. There's a lot of other things that could cause pain there. So just because you have chest pain doesn't mean you have heart pain. However, there are some characteristics, and that is something like when people go, well, you know, there's no point I can point to. It's like in the middle of my chest, like pressure in my chest, and it's like all over. It's not a specific spot. If it's a specific spot, then it's going to be, you know, the ribs or the muscles or some tendons or whatever, inflammation, for example. When it comes and goes with exercise, then the heart pain is usually from clogging of the arteries. We've already established that you don't have clogging of the arteries, so that's probably not your issue. However, your thought of having this stress or emotional issues show up is with chest pain. That is a very important thing, because most people who go to an emergency department with, I'm having a heart attack, and classic angina, chest pain, are actually not having a problem with, they don't have clogging of their arteries, they don't have clots, they don't have calcifications like you. But they do have a heart problem. So they can look at the EKG and go, oh my gosh, you're having a myocardial infarction. But then they look in the arteries are clean. And that's like 60% of the time. So it's not an uncommon thing at all. Very common to have stress-induced or anxiety or grief induced chest pain due to heart. So a broken heart is a real thing, and you can get chest pain from a broken heart.
I might
That's
start.
very, very interesting. Cheryl knows my love for Disney World. And this is just a thought here. So yesterday I was looking, I found this thing on Instagram. It's like old things from Disney World from like 20 years ago. And they show you the rides that used to be there and what things used to look like. And I got, for about 5 minutes, sucked into this. And the things that were happening to my stomach by watching that, like, it was emotional for me. And so this is just, I can relate in that way, where certain things affect your body, not physically, but the way you're taking it in emotionally can just trigger things very quickly. And another thing I was just going to share is I started using this app called Nerva, and you do these 15 minutes a day. They call it like hypnotherapy, but you're awake. And it teaches you to retrain your brain gut connection, because there's such a big influence. Your brain has such a big influence on that when you're stressed or whatever. So I can only imagine that the heart is the same way. In fact, I know we've had people on our calls talking about broken heart issues when they've gone into the hospital. I think is that what it's actually called, Dr. Saunders? Broken heart syndrome or broken heart? There's some word they use.
Yeah. Broken heart syndrome. I don't know.
Yeah, I don't know. I've read a little bit about it, and we've had many people on the webinar who have shared that.
The medical word that we use is called Prinzmetal's angina.
Yes.
Yeah.
Yes. Very interesting.
I have a question. Yeah, I know people that have had like a panic attack. Is that related to this at all? Like, it feels like a heart attack, but
possibly. In fact, most of the time, when people go to the ER thinking they're having a heart attack, they test them and they send them out saying you had a panic attack.
Oh, wow.
Yeah.
Okay.
what's the official name for a panic attack?
A panic attack.
Okay.
Yeah, panic.
I thought it was some like infarction or whatever.
Great. This is good. Thank you for sharing this. This is good. And if you want to hang around and listen to some of these other things that may relate, if you have similar stories or thoughts that you would like to share, we would love to have you guys post about that either in the chat, or if you have questions, ask those in the Q&A. Tony, first of all, Tony is back on our webinar. How are you? Good to see you. There are 2 separate comments that say great looking bunch right there. Oh.
Well, Joe has something to say.
Okay.
I was going to ask you, Jim, like, have you experienced like an increase or decrease in that heart or chest pain over time? Like, or has it kind of just come and gone in equal levels?
It's been more intense lately, but I think first of all, it was anxiety. When the doctor said, no, that's not normal, all of a sudden I started feeling it more, so that made me anxious. I went through the stress test and all that kind of stuff, and I felt relieved that they weren't like, hey, get him in the operation room right now. So that felt good that I didn't have to go. But the pain is still there, and it's like, okay, is it just grief and will it pass? And jury's still out on that. But I'm glad I'm talking about it just so I'm not freaking out about it.
Mhm.
And so I do have relaxation techniques that my therapist has cued me into, and mindfulness.
Does that work?
Yeah, it helps. It helps, but I can't, it's kind of I don't know, oxymoron is the right term, but it's kind of like, you need to feel your feelings, you need to feel the grief, which is painful.
Yeah.
And so, but if I'm in mindfulness and meditating, I say, okay, I'm not gonna.
You don't feel.
Yeah, you don't feel. So it's like, what's the balance? And well, I'll see her Tuesday. And but I mean, it's a tough one, because it's like, okay, I want to get freed up from some of this stuff, but I don't want to be miserable the rest of my life.
So is it a case of it's going to get worse before it gets better?
I think so. And actually, AI, I searched some grieving deals, and it's pretty amazing the responses that came back on it. It was, and I mentioned some of my therapists, and it's like, well, I'm being replaced by AI. I'm like, pretty much, but jokingly, but the AI was like, yes, it's important to feel the grieving, to feel the pain. It'll pass, what have you. So I'm hoping that it'll pass. I believe it will. I mean, this isn't the first rodeo of heartache.
Mhm.
So,
Physical or emotional?
yeah.
Yeah.
It only happens to be about every 2 weeks with some. I'm kidding.
Did you have other questions for doctors?
No, I think that, I mean, it sounds like you reading the results and listen to me, it sounds like, yeah, emotionally,
Mhm.
the stress can cause pain.
Mhm.
Doesn't mean it's a heart attack or anything. So no, I'm feeling good with the, review, your analysis and whatnot. So that helps, and,
So,
Okay.
Dr. Saunders, what do you recommend for like grieving? Like, how do you grieve, and like, what does that look like? There's different levels and layers and
Different levels and layers and different ways of doing it. And there was a case of a woman who went to see Dr. Bessel van der Kolk, who has done a lot of research on this. And she was in her 80s, and she had moved out of her house that she'd lived in for 40 years or whatever, and had to go into a assisted living facility, and she started getting panic attacks and chest pain and these kinds of issues. And then so he talked to her about, where is this coming from? And it went back to her childhood in Poland during World War II, when her parents were killed and then her foster parents were killed, and she had to go all by herself as a little girl to England, and then eventually to the United States, and she became a teacher. She had children. She had a family, and her children were out, and they were doing fine, and but her husband had died, and so she was moving into this assisted living facility, and there was something about that move that triggered something from 60 or 70 years in the past, that triggered a grief reaction that had been that long in coming. So how people deal with grief is sometimes, like in her case, well, I'm just going to get busy. I'm going to do this and do that. And she did. She had a job. She had family. She's taking care. She's doing things. And some point at which she goes, wow, I don't have anything to take care of anymore. And then the grief comes out, because the way that she was burying it is no longer there. So people bury grief. That's a very common thing. But actually dealing with it, what Jim is talking about is going to the therapist and saying, gosh, I have these issues. I have relationship grief. I've had heartbreak, and actually dealing with it is a really good idea, because what Dr. van der Kolk explains is that the body will tell you that there's a problem, but the way your brain has of telling you there's a problem is with pain. And so people get back pain and they go, oh, my back hurts. And they don't realize that that's an expression of a lack of support. They're feeling, in a way, grief too. Neck pain is also very common. Problems with knees and hips and, different things can all be related to a lack of blood flow. Well, guess what? The problem with the heart is when you have chest pain, your blood vessels are constricted down and they're not allowing the blood flow. So it's the same process, just different locations.
I've heard that sometimes your brain doesn't know the difference whether or not you're actually experiencing it or whether you're thinking about the experience. So let's say you get frightened by a bridge that comes up when you're trying to drive over it. Every time you think about that bridge, you're going to think, your body is going to think you're actually experiencing it. So
and you get the palpitation.
Yeah. Didn't you have a story about a shoulder?
Yeah.
Yeah.
My own shoulder.
Your own shoulder.
Yeah, actually. A similar kind of process. A friend of mine came to me and said, my left shoulder hurts and I've never injured it. It just started hurting. And it's been like 6 months of pain. And it's just not going away. And it's pretty painful. Like I can't do everything. And so I looked it up in a book. What's her name?
Body Keeps the Score. Or no,
No, not that one. The
No.
other.
Heal
Your Body. Yeah.
can't think of what it's called. I know what
Yeah,
you're talking about.
Heal Your Body. Anyway, so I looked it up, and the shoulder is grieving, and the right shoulder is the power. So you're grieving a loss of power or masculinity, whereas the left shoulder would be grieving a loss of support or femininity. And so he had right shoulder pain, and I said, okay, so where's your loss? He goes, oh my gosh, I lost my job a year ago. I haven't been able to find a job. My wife's supporting the family. I'm driving for Uber, but it's not paying the bills. And, this is a really terrible thing. So he said, what do I do? I said, get a job. So he did. And within 2 weeks, his pain was gone. So when he reported that his pain was gone, I'm going like, you know what? I've had left shoulder pain for a long time, like years that I've dealt with it. And I had to put my shirts on a certain way, and I couldn't get my robe off the hook. I had to always use my right hand because my left shoulder was hurting all the time. And so I started thinking about what kinds of things, okay, left shoulder, grieving a loss of support or femininity. Okay, so what have I lost? And I'd been through a divorce, and I had my children had moved out. My daughter was my youngest child, who just went away to college. And so I was thinking, okay, was that it? That could be it. That could be it. And then I had another issue with getting remarried and having a long distance relationship. And I realized that was the issue. That was what it was. And so I went to a therapist to start dealing with it. And before I had even dealt with it, I felt better. Like the pain went away. And it was a couple of weeks, but within a couple of weeks, the pain was completely gone. I had full range of motion. I could do everything. I put my shirts on in either way. It was amazing how everything cleared up when I started dealing with what was the real problem, the underlying problem.
Someone is asking the name of that book. You know what? I'll look it up. I actually have it. It's in the other room, so maybe I'll sneak over and grab it. Would you mind sharing the story also about the lady who could not get rid of her type 2 diabetes?
Oh yeah.
Their daughter.
Oh
Yeah.
yeah. It was a stress response. So you have there's stress makes everything worse. Like it's not that stress causes illness. In fact, there's no specific illnesses stress causes, but whatever you have is going to get worse due to stress. So in this case, this woman had uncontrollable diabetes, like over 200. Her blood sugar was always high. And we had her on multiple medications, had her going to specialists. had her injecting insulin like 200 units a day, which is like 10 times what a normal pancreas puts out. Just everything, and her blood sugar was still uncontrollable. And then one day she called and her blood sugar was normal. No, it was below normal. She had hypoglycemia. I said, get off don't give yourself insulin, drink some orange juice, and stop the medications, because she was hypoglycemic and like in the 30s. So she was really low. And then we tried to figure out what the problem was. Did you change your diet? No. Did you exercise? No. Are you doing anything else? No. Has anything changed, your job or anything? No, nothing. Nothing has changed. And then we figured out, I think it was a few weeks later, we figured out that her daughter had moved out of the house. And when they were together, they were constantly battling. It was like a constant battle when they were together, and her blood sugar was always high. As soon as her daughter moved out of the house, they became best friends. Her daughter calls her, "Hi, Mom, how you doing?" And they're like best friends talking on the phone and not living together. And all of a sudden, she does not have diabetes anymore. And the weird thing was, it wasn't just that her blood sugar got better. It was that off medications, she did not test positive for diabetes at all. Like she didn't even have it. So stress is big. It is big.
Yes. I believe this is the book, Louise Hay. Oh,
Yes, that's the one. Louise
there we
Hay,
go.
you buddy.
There you go. I want to bring this up. Beverly said, isn't it a good idea to address the calcifications, even if they aren't totally clogging arteries yet?
Yes, thank you. That is an issue. So if you have few calcifications, depending on your age, it's not as significant. It may not be significant, but asking why do you have the calcifications? Is this because you have inflammation? Are you making more clots in your arteries? Or is it because you're not breaking down the clots very well? There's certain genetic problems like lipoprotein A, autoimmune diseases like phospholipid syndrome, antiphospholipid syndrome. There are things that should be tested for, because the coronary calcium score should be 0. Ideally it should be 0, and that means that if you do make clots and do damage, then the clots dissolve and the artery comes back smooth and normal, and there's no calcium deposits, no inflammation, and that's how you know.
So when he sees his doctor, what do you suppose they're going to say to him?
Well, actually, that I was just looking that up, and they said something about this was a recommendation to the doctor. He will need risk factor modification. I don't know what that means. I would recommend baby aspirin if no what is that?
No contraindication.
What does that mean? Contraindication. I thought that was
That isn't-
contradiction.
Well, if you have no reason why you can't take it, like if you have
Oh, okay.
peptic ulcer disease, you definitely should not
It's not
take
going to
aspirin.
interfere with other medications or
Okay, and his last LDL was 111, suggests 10 milligram.
Rosuvastatin.
What is that?
That's a statin. That's
Okay.
for lowering cholesterol.
And are there side effects to that? That's going to be my
Yes.
question to the doctor. But yeah, can you talk about the side effects?
Yeah, so rosuvastatin and other statins have issues with dropping the cholesterol. And cholesterol is one of the most important chemicals in your body. So of all things, cholesterol is kind of a basis for all of your hormones, the steroid hormones like cortisol and testosterone and estrogen and progesterone, DHEA, pregnenolone, and even coenzyme Q10. So the cholesterol is what's necessary for making all of these things. And so every cell in your body makes cholesterol. The cells themselves, the cell wall, the membrane around the cell is made out of cholesterol. And without cholesterol, you can't make a single cell. So you have to have cholesterol. The the insulation around the wiring in your brain is all made out of cholesterol. And so your brain won't function without cholesterol. So one of the issues of taking these drugs is it drops the cholesterol. And by dropping the cholesterol, then you don't make cells as efficiently. So you age faster. You don't make hormones as efficiently. So you have less hormonal support. And you don't make energy as efficiently. So you don't make as much energy because you don't have much coenzyme Q10. So there have been some of them that were the most potent ones of these drugs had to be taken off the market because like people were dying left and right. It was a big deal. So, but you know, these other ones, and they're also and that's why they're related to things like Alzheimer's disease, dementia. Yeah, I usually say, what is a better way? Because the side
I'd be
effects.
interested in that, yeah.
Yeah.
Then also, you can follow up with his primary care physician for follow-up lipid profile or with my
Mid-level provider.
Oh, that's
Yeah,
their provider.
That's
So,
their, yeah.
but what's a lipid profile? Is that just the?
That's the cholesterol test.
Okay,
Yeah.
if I get it. or
Yeah.
not.
So
Either
what do
way.
you recommend then, Dr. Saunders, for people who may be in a similar situation or their doctor's recommending a statin? What do you think? Where should we go?
Well, I think everybody should look at their doctor as an advisor.
Right.
And then take the information, the advice of your doctor and say, is that good advice? And ask that question, is that good advice for me? Because the doctor has kind of blanket advice for everybody. Everybody gets the same advice because that's called the standard of care. But it doesn't necessarily apply to any individual in that group. So for example, on statin drugs, I've put 3 people in the last 30 years on statin drugs and say, yeah, you just need to take this the rest of your life because they have something called familial hypercholesterolemia. And they don't stop making, they don't have a stop mechanism for cholesterol. So they need to be on that medication. And so, yes, some people do need it. But they're overprescribed by a lot. And so it's incumbent on each person to say, okay, the doctor gives that advice to everybody. Does that apply to me? And then find out if that applies to you.
Very good. You know, we've had a couple different questions about diaphragmatic breathing or breath work. Why does that help with stress from maybe what's happening in the body perspective?
Well, for me, taking deep breaths in, actually it's like 4 in, 4 seconds in, 6 seconds out, kind of a repetitive motion. I just started doing this about a year ago. Prior to doing that, my breath was very shallow. In other words, I was very tense. And by doing the breathing, it just relaxes everything and opens everything up. So I don't know if that answers the question, but for
Cheryl?
me, that's what works. You know?
Cheryl,
What,
how does it work?
how does it
The
work?
breathing, yeah, for you.
It helps bring relaxation
Yeah.
to me. I do different kinds of breathing. I do a box breathing. It's called 4 in. You hold for 4, 4 out, hold for 4. Or Esther's taught 4, 7, and 8. I think you breathe in for 4, hold for 7, and then release for 8. And basically, it causes the blood vessels to expand and allow more blood flow. Am I correct? And then
Yeah.
that brings more relaxation. Because when you're tense, everything constricts, including your blood vessels.
Yeah, exactly. So what you're doing is stimulating the parasympathetic nervous system. And that parasympathetic nervous system is the relaxation response, as opposed to the sympathetic nervous system, which is the blood vessel constriction response. So that's why.
Awesome. Okay, let's dig into some more questions here. Let's see. Paul says, I stopped my statin because I thought it was behind my quite low cholesterol of 95. Now it's 175, but my triglycerides are high, 178. What should I do?
Okay, that's a great question. Thank you for asking that. Okay, so your cholesterol being 175, that's a lot better. That'll allow you to make your testosterone more. It'll allow you to make all of your steroid hormones, cortisol, and all those that are necessary, and prevent you from getting damage to your brain from not being able to replace those cells. So the cholesterol, 175, that's fine. You don't need to worry about that. That's pretty good. The other one is the triglycerides. And elevated triglycerides means you are not efficient at burning fat for energy. So triglycerides are the fats we use for energy. That's what is coming out of your fat cells. That's what, when you're eating fat, that's what goes into your blood. And if that fat can't be used, if it's not being pulled into the mitochondria to be used for energy, then you have less energy. So normally about 60% of our energy comes from fat and about 40% comes from sugar, 60-40. And that's an ideal situation. But what ends up happening with like insulin resistance would be one reason. You actually have less fat burning and more glucose burning. And because you have more glucose burning, you have more inflammation. And because you have less fat burning, you have less energy available. You actually make less ATP. So that is really important. If your triglycerides are high, it usually means there's some block in your ability to use fat for energy. And so insulin resistance would be the most common, but there are other things, people that lack carnitine, for example. There's various types of genetic defects that do that, one of them being carnitine, that brings the fat into the cells to be able to be used. So the next step would be to do testing. Why are the triglycerides high?
Okay. Tommy said, I've been doing your program for 2 months. I'm the guy that the doctor wanted to go in and put a stent in his heart. I've lost 26 pounds. I've lost 4% body fat. I've gained 3% muscle mass as of yesterday, and my heart feels like it's pumping better. My blood pressure seems to be fine. What test, when I go back in August, he wants me to check out? What should I tell him? What test should I do?
Okay, that's a good question, because a lot of people will look at the coronary calcium score and say, okay, oh my gosh, I've got, all this calcium deposits in my arteries. And so I'm going to go on this program and I'm going to reverse this and lose weight, and I feel better and I'm exercising more. I got more muscle mass. All that looks really good on paper. And then they go into a coronary calcium score and it's worse. Because the coronary calcium score is not a measure of the blockage of your arteries. That's not what it is. It's a measure of the clots that you form in your arteries are not dissolving and going away. They're organizing instead of going away. And so they're causing stiffening or hardening of the arteries. So don't go and do the coronary calcium score, because I actually had somebody who did that, who was like working really hard and he was doing great. He's 85 years old. He's walking 3 miles a day and up and down hills. And he was, and before he was a cardiac cripple, like he couldn't even walk across the room without getting chest pain. So, up to 3 miles, that was amazing. And then doing hills and stuff. So I'm like encouraging him, you're doing great. You're doing great. He goes, okay, I want to do my coronary calcium score. And he did, and it was worse. And he got so discouraged, he gave up, he quit, and he started eating again, gained weight, started eating like his comfort foods, and gained weight back again, and then became a cripple, like he wasn't able to do his walk anymore and all of that, because his expectation was that he was going to be better, that his coronary calcium score was going to get better. It's not the way it works. So that's not the test. Okay. Just so that you're clear, that's not the test. So as far as the need for a stent, coronary angiography, the putting the dye into the veins and looking at the internal parts of the artery or the arteries of the heart, it is the only way to really see it well. And there's no other way, and you can't. So I don't know, I don't recommend that kind of thing, because there's risks to that too. So I think if your function is good, like this guy, this 85-year-old, the fact that he could walk 3 miles and go up and down hills and not have any chest pain and mow his lawn was the other big thing that he was able to do that he couldn't do before. And so now he was non-functional, and now he's functional. The testing's irrelevant. So look at testing as, oh, I've got a problem. I wonder what the problem is. Like Jim, they could have said, oh, you have chest pain. Well, we should do cardiac bypass surgery on you. And if they just walked into cardiac bypass surgery, then find his arteries normal, they're gonna have to stitch him up and go, hey, your arteries are normal. We didn't need to do anything. You have to assess the problem. So the purpose for testing is to assess a problem. And so you already had an assessment, you had heart disease, and you go, okay, I'm going to reverse this, and you reversed it, then that's it. You're done. You don't need testing.
So why would the calcium score go higher if someone had decreased weight, been exercising, and improved the diet?
Good question, because that's not the issue. The coronary calcium is not what's causing the problem. It's an indicator that there's atherosclerosis, that there's atheromas, that there's hardening of the arteries. It's an indication that you're forming clots in the arteries. It's an indication that your clots are not dissolving, but organizing in the walls of the arteries, and they could narrow the arteries. It's an indication that there's inflammation in the arteries. So if you look at the coronary calcium score as an indicator, there's something called hard plaques and soft plaques. And the hard plaques have the calcium in them, and the soft plaques don't have calcium in them. And so when you do a coronary calcium score, you're really looking at just the calcium, and there's soft plaques around it, maybe, probably, that are not calcified yet. And so a year later, you go back and now they're calcified and your score is worse. But that's not the issue, because those were there before. And it's not that it's getting worse. It's that it was there and now it's organized and it wasn't before.
All right, organized like army.
Yeah. Well, they call it organization, where you have this clot that's just a bunch of fibrous tissue, and then it organizes into scar tissue. Essentially, that's really what it is: scar tissue that has calcium deposits.
So the indication you have say it again, calcification,
yeah,
doesn't necessarily mean that it's a danger.
No.
Oh, okay.
No, and that's what they said in your report.
Right.
They said,
right.
they said there's a minimal calcification. There's no evidence of heart disease.
So you're in better health than you think, or what your
Right.
doctor's telling you.
Right.
Or
Yeah.
might tell.
Yeah.
It's good. Okay, another question. Here we go. Krish, welcome back. Krish says omega fatty acids are anti-inflammatory. Fine, but are they organ specific? For instance, if one has severe inflammation of the gut, what type of omega should one take?
Oh, great question. No, they're not organ specific, because every single cell is being made out of whatever fats. The envelope of the cell, it's called the cell membrane, is being made out of whatever fats you're eating. And so if you're eating omega-3, that's what your cells are made out of. If you're eating omega-6, that's what your cells are made out of. And so every cell in your body, which means, like you mentioned the gut, Krish mentioned the gut, those cells are being reproduced rapidly. Like, every few hours you can replace those cells in the gut. And so whatever fats are around, that's what they're using. They're pulling out all whatever's in your blood the triglycerides and cholesterol and everything that's in your blood to make a cell. And so if there's a lot of omega-6, you'll tend to cause inflammation more. And if there's more omega-3, you'll have less inflammation. And that is in the brain, in the liver, in the gut, and wherever your cells are being made, in the blood. All your blood cells, your red blood cells are being made out of those same fats.
Okay, so Beverly had asked, she said, isn't it a good idea to address the calcifications, even if they aren't totally clogging the arteries yet? But then also asked, wouldn't we want to increase nitric oxide?
Maybe. So that is a very interesting thing. If you have a deficiency in nitric oxide, you may want to increase nitric oxide. And some people do. Some people don't have enough arginine, which is the amino acid that's made into nitric oxide that allows blood vessels to dilate. That if you don't have enough, then you're going to get constriction of blood vessels, and they're not going to be able to dilate where they need to. So nitric oxide allows specific tissues in specific areas to dilate blood vessels where everywhere else they may be constricted. So for example, when you start exercising, the muscles that you're using will send a signal, and you'll start making nitric oxide to open up the arteries going to that muscle so that you have more blood flow in that muscle. Whereas another muscle in your body that you're not using is still going to be constricted and not be opened up. So don't think of nitric oxide as something like that's automatically used everywhere. That's not the way it works. It allows your body to selectively dilate blood vessels to allow blood to flow more into one area than another area. So you don't have this like open, have total blood flow everywhere in your body. And then your heart would have to like pump twice as much blood to get it all over the place. So that selectivity is what's important. And so, yes, people who are deficient in nitric oxide or are deficient in arginine may need that to increase nitric oxide so that they can have normal changes in their blood flow.
Another note from Beverly. Beverly said that her husband, and it said, my husband and I authored a chapter on cholesterol. Diet modifications are useless. Stress raises it and exercise lowers it. Those are the only two significant effects based on a meta-analysis of many large studies within large sample sizes.
Yeah.
That's pretty cool, Beverly. That's awesome. Okay, let's see. Christine says, I have been working hard and doing well to get better cholesterol numbers. Well, now you have all the answers from Beverly. She just told you what to do. Okay. And yeah, okay. And Christine says, doing well to get better cholesterol numbers and have been on a very low dose of, I think you called it rosuvastatin.
Yeah, rosuvastatin.
Okay. But now I thought I was safe from having to try to pronounce that word because you guys had it on a piece of paper and you read it and I didn't have to read it. And now someone else brought it up. So I had to try to say it again. I think I got it. So, okay. But now my HDL is only 47. I plan to ask my doctor if I can stop the statin and see how things go. But what about the HDL?
Okay. So, looking at each one of those numbers and parsing them out is really unnecessary. It's a lot of unnecessary work because that's not the issue. It's when you look at cholesterol and you see the cholesterol is 300, or your HDL is really low, or your LDL is really high. Whatever, when you're looking at the cholesterol and the numbers are way off, you go, okay, you ask the question, why? Why are those numbers elevated? And then once you know why, then you know what you can do about it. So like Beverly just said, stress brings it up. And not only does stress bring it up, it makes you insulin resistant. It increases your triglycerides. And so you're going to have, multiple issues from that kind of thing. Exercise brings it down. And when you're exercising, that's a great way allow your muscles and everything to repair and to fix things and use the cholesterol that you have. And then as far as diet goes, there are things like a very high fiber diet can lower the LDL and change the ratio, for example. But ultimately, the issue is to have a normal cholesterol, and that would be right around 230. And so if your cholesterol is over 200 and your HDL is only 47, yeah, I don't know. I wouldn't suspect the statin would be the right thing for you.
Anonymous said, I usually have some GI issues with some oral magnesium preparations. I am not keen on using sprays because of propellants, etc. Are there any effective sublingual magnesium preparations?
Okay. This has no propellants in it.
Right.
You actually have to physically use your finger to pump it.
It's not sublingual. That's not sublingual. Let's just make that clear.
This is topical. Yeah. Yeah. It doesn't taste good, so you don't want to do it.
We'll
But-
try it.
But you do like, spray a significant amount, 50 to 100 times all
Yeah.
over your body, and just let it dry on there. And you do absorb it through your skin. That's been proven.
Could Jim demonstrate that quick? Just like spray it all over?
That was the peanut gallery.
So
I
the
recognize that.
question about sublingual is really, does the under the tongue allow absorb magnesium? And the answer is, well, yeah, just like it does on your skin, but very small amounts. You're not going to get very much. Most of the sublingual is actually being swallowed and absorbed in the intestines, like other magnesium. So yeah. If
And I
you-
wanted to point out too, we also have an omega product because we know how important that is. And Dr. Saunders also mentioned how important fiber is. So we also have a fiber greens product. So we don't do these just to have them. We do them because they are helpful. And how do you get them, Leslie?
Well, look at your screen right there. Okay. So here is bartonnutrition.com. You will find all of these supplements there. You can go to Barton Webinar as well. Those of you on the webinar, I just tend to say go to Barton Webinar because they get a lot of questions about, well, how do I find the replays for this? How do I find a link for this? Barton Webinar is your hub for all the things you're probably going to need. But if you look, this is just some links to some of these supplements where you can find the ones that we've been talking about today. Terry actually also mentioned that that magnesium spray is great. I use it every night. Me too, Terry. Use code webinar25. That's one word. You'll save 25% on any of these. Look at this new bag. Those of you, you know what? People tell me I said bag weird. I was traveling. I was in California and they were like, what did you say? And then I'd say bag and then they'd laugh because I say it so funny. But anyway, I love the new fiber greens right here. It used to be in that canister, but the bag is so fun. So that's something new that you guys maybe haven't seen. And all of these, including the Healthy Heart Solution Kit, the Diabetes Solution Kit, those books, you can get all of those for 25% off. So there's our Easy Relief Magnesium Spray. I think everyone on our team uses this from what I remember. So really good. I keep mine right in my nightstand because I spray it right before I go to bed. But anyway, use code webinar25, save 25%. All right. Oh, we're running out of time. It just goes so fast. Okay, let's see here. Roxy says, is there a way to increase cholesterol with any kind of supplement or herbal remedy or food?
To increase cholesterol?
Yeah.
You know what? That's a good question. So, if there is an optimum level, if you look at the mortality table versus cholesterol level, and clearly 230 is an optimum level. So if you have like 170, how do I get my cholesterol up? I really don't know. I don't know how that works. Eating more cholesterol, like Beverly was saying, The diet doesn't really have that much of an effect on it. Although if you're insulin resistant, it tells your liver to make more cholesterol, you make more LDL cholesterol. So, not immediate dietary changes, but general dietary changes. I don't know. I don't know of any supplement that increases cholesterol either. You know what? I'm going to research that, and then we're going to talk about that at the next webinar.
All right. Sally says, I have too high triglycerides. What kind of test is used to see why my triglycerides are high?
Oh, good question. Okay. So start with insulin tests, because if you have insulin resistance, that prevents your body from using fat for energy, because insulin tells your body don't use fat for energy. So all of the insulin resistance tests, so the insulin, C-peptide, glucose, and hemoglobin A1C, and that'll give you an idea of insulin resistance. The other ones that you should look at are what are they called? The antiphospholipid syndrome, the antibodies. That would be a different phospholipid. I have had rarely, I don't do it very often, but the test for the acylcarnitine, it's a carnitine test that tells you all the different types of carnitines in the body, and that's what brings the fat in, and that I usually save until because the obvious one usually is the insulin resistance, and if it's not that, then I go, oh, okay, let's start looking deeper and do that carnitine test.
All right. Speaking of carnitine, not really, but it was close to the word carnivore. Somebody said, what are your thoughts about the carnivore diet that seems to be gaining traction?
Okay. I've been looking at it. I've been researching it. And for some people, it seems to be like a useful thing to do. And I don't think everyone can do it. And I don't think everyone will do well on it. I've had some people talk about your blood type. People with type O tend to do better on a carnivore diet than type A blood. And there's a whole book written about that and why that is and everything. And I read the book, and it's a possibility. I can't discount it, but it's just hard for me to say that everybody with type A blood should be on a vegan diet and everybody with type O blood should be on a carnivore diet. I'm not that black and white. But the carnivore diet can be useful. In fact, I just read a book by a psychiatrist from Harvard who has been curing schizophrenia, bipolar disorder, anxiety disorder, major depressive disorder. I mean, these are people who are on heavy medications like sedatives continuously. And he puts them on a carnivore diet and they get off all their medications and they get better. So, for brain function. And so, but it's not just a carnivore diet. Yes, some people are on a carnivore diet, but he uses a ketogenic diet. So it's not really carnivore because there are some vegetables that are allowed that are non-starchy without sugar vegetables.
We have a friend who did the carnivore diet, and he got rid of all of his rosacea he had on his face. He had psoriasis, and he got rid of all knee pain and knee inflammation. 3 months.
And I think it depends too on what you were eating before. For some people, if their diet was full of not real food, and they go to carnivore, I think they're going to have great success for a little while at least. And just, I don't know. I like to follow Paul Saladino if you guys are familiar with him, or if you want to just find some more information. I think he did strictly carnivore, but then he started adding in some things like raw dairy and some fruits, because I think he found that his testosterone level after like 5 years just tanked. And so he added in some other things and he feels great. So he still doesn't eat a lot of other things. Mostly it is just carnivore diet, but very interesting. It's fun to just see what works for people. And then you have the other side where people will say 100%, like Dr. Saunders, we talk about the book Fiber Fueled. That works great for some people too. So there are a lot of options out there. You can probably find what you're most interested in, and it'll work if you just do it. Okay, we're running out of time. I'm going to ask this question quick. Anonymous says, I learned from chiropractors that stress has a tendency to drop potassium levels, thus exacerbating pain, and etc. Because if the serum potassium is low, it draws potassium from the muscle through osmosis, thus affecting the muscle tone for supporting the joints, spine, etc. What causes the serum potassium to drop, and how is that related to sugars and carbs in the diet?
Whew, okay. Okay. So
Oh.
what caused the potassium to drop is the kidneys excrete more. When you have a lot of stress, the adrenal glands control your sodium potassium balance. And so, the hormones from the adrenal glands tell the kidneys to get rid of potassium and hold on to sodium. And so you change the balance by having more stress. So that is a thing. And then the energy of your body is dependent on that potassium, and that's intracellular potassium that he's talking about. The potassium in the cells, compared to the potassium outside the cells, the wider the difference, the more voltage you have in the cell and the more energy that the cell can make. The less energy you have, the harder it is to relax muscles. So you end up with spasms, contractions, and all that from low potassium. So that actually is a thing. So what can you do to increase potassium? You know what's really interesting? Your kidneys will get rid of all the potassium you eat or drink or whatever if you have that imbalance in the adrenal hormones. So you still have to deal with the stress. This is not something that you can work around the stress. You got to get rid of the stress and get the adrenals functioning properly, and then the potassium in your food will get into your cells, and you'll get a wider voltage, better voltage for better energy.
Right. That's it for today, you guys. Thank you all for being here. Joe, Jim, Cheryl, Dr. Saunders. So fun. This is your last day. Go and celebrate. Go eat some Italian food. Is that where you're going?
Yeah.
Yes, we're Italian.
Yay, that's fun. Okay. All of you, we'll be back here next week. You can go to bartonwebinar.com to get more information about these webinars. Sign up for the diabetes webinar as well. They're free. You can also find information about our supplements, but use code webinar25 to save 25% on anything that you may want to purchase. We'll see you next week. Thanks for joining us.